Hello, my name is Sumaya Raghavan and I have with me Anand Srivastav, and we are from Revive Heart Foundation Eye Care Holy Family Hospital, Mumbai. And today we're going to teach you 4 simple steps on how to help a person suffering a sudden cardiac arrest. So step number 1, we're going to learn in step number 1 how to recognize if the person who's collapsed in front of you has collapsed due to a cardiac arrest or due to some other reason. So how are we going to do that? Assume somebody has collapsed in front of you, either sitting down or sideways. The first thing you need to do is put this person on the floor. Put the person completely on the floor and check whether he's responsive. So you have to tap both his shoulders hard and ask, are you okay? Like this. Hello, are you okay? So you can see Anand and me like this. Hello, are you okay? Are you okay, sir? Here you do not have to give him love and affection. You have to hit him a little hard, shout a little loudly, sense of touch and sense of sound, both the ways we are checking if this person is responsive. So, hello, are you okay? There's no response. That means you know this person is unconscious. Now you have to check whether this person is breathing. So there are different ways of checking if a person is breathing. You can put the finger under the nose, you can check the artery, you can check the pulse. All these ways are not wrong, they are correct. But we are going to teach you the fastest way of checking if somebody is breathing, and that is by putting your hand on his abdomen, pressing it for 10 seconds and check if there is a movement, if there is breathing. So you keep your hand here, press it for 10 seconds and check if there is any movement, if there is breathing. Now, if you find there is a breath, that means this person has collapsed due to some other reason, rush him to the hospital. But if there's no response and there's no breathing, that means you have identified this person has collapsed due to a sudden cardiac arrest. So our first step, no response, no breathing, we have identified a sudden cardiac arrest. But when you see no response and no breathing, don't think the person is gone. The person is in a cardiac arrest. He has 10-15 minutes of time and you have to help it. So our first step, no response, no breathing, you have identified a sudden cardiac arrest. Vilma, can we have the slide, please? Step number 1. So as you can see in the slide here, person is made to lie down, tapping his shoulders, no response, no breathing. We have identified a sudden cardiac arrest. This is our step number 1. Now we are going to step number 2. In step number 2, we need to call for medical help. Vilma, can we have step number 2, please? Remember, this collapse has happened outside the hospital. So you need to call for medical help. Now make sure you have saved in your phone today emergency numbers, that is hospital numbers, around wherever you're working and around wherever you're staying in your phone today, because an emergency can happen anywhere, anytime. At that point of time, you'll think, I wish I had saved emergency numbers. So please save hospital numbers in your phone today. And also there's a government service number, could be 108, could be another number. Make sure you save the government service number also in your phone so that you have an alternative number in case you cannot get through. Now remember, when you call for an ambulance, at that point of time, it's a very panic situation. Person has collapsed. There's a lot of chaos and noise. So you may call the hospital and ask, please send me an ambulance. At that point of time, a ward boy will come in a small ambulance with a stretcher. But in this situation, whenever you call the hospital, make sure you ask for a cardiac ambulance, because every cardiac ambulance has a doctor as well as this machine. So make sure in your second step, when you call for an ambulance, you ask for a cardiac ambulance. And also, if you know this machine is anywhere placed around you, they're placed many at the airports and the big malls. So if you know this machine is somewhere around you, ask somebody to get the nearby AED machine. So step number 2, you're going to call for a cardiac ambulance and for the AED machine if you know it's somewhere around you. Anand, you would like to add something here? You're on mute.
I'll just add very quickly about 108. So 108 happens to be a government service number. It's absolutely free of cost. Now, I'd like you to know that 108 is operational in 18 states of the country. So it's not about just one state. If you happen to be in another state, for example, and something untoward has happened and a person has collapsed due to cardiac arrest, so you're right in front of the victim and you want to avail of the services, you need to quickly Google for 108 whether it's available in that particular city that you're in, and if it is operational there, you need to quickly dial it and call for help. Yeah. Okay, so man.
So we have recognized the cardiac arrest and we've called for medical help. Now we are going to step number 3, where we are going to learn how to do CPR or cardiac massage. So first of all, we need to understand where this is given on the body. So if you can see the mannequin, think of an imaginary cross. The point between the two nipples, the center point here, is the point where you will be doing cardiac massage. So if you feel your body from the top, there's a hard sternum and then there's a soft portion that goes in lower sternum. This is the point where you will do CPR. Remember, the point is the same whether it's a man or a woman. Now we're going to show you hand positions, and we wish that you would also do this with us so that you understand how hand positions are kept. So put your dominant hand straight, make sure your elbow is straight, your hand is completely stretched out, open up the fingers and interlock it from the top with the other hand. You can see Anand and me doing it this way. This is the correct way to keep your hand position. Hands completely tight and interlocked. This is called the heel of the palm. This heel of the palm will come in this center point, the point between the two nipples. And how to do CPR, we're just going to show you a small video. After that, we're going to teach you even more in detail. You can see on the screen, person is made to lie down, heel of the palm, center of the chest, and he's ready to do compressions. Now, these compressions need to be done either from the left-hand side or the right-hand side of the person, not from the head side and not from the leg side. So let's watch this.
Now it's your turn to practice. First, get into position. Place the heel of one hand on the center of the chest. Put the heel of your other hand on top of the first. Follow along with the drum beat. Let's begin. Push straight down, hard. Push down at least 2 inches. Push at the rate of 100 to 120 compressions per minute. After each compression, let the chest come back up to its normal position. Keep your compressions going until the drum beat stops.
Heel of the palm, center of the chest, elbow straight, full pressure coming from the shoulders. Is compressing down, allowing the chest to rise, compressing down again, hard and fast. This is the way CPR or cardiac massage has to be done. So as we saw in the video, heel of the palm, center of the chest, and he started doing the compressions. Now these compressions need to be done at the rate of 100 to 120 beats per minute, going down 5 centimeters and recoiling. This is the rhythm, 100 to 120. But why this rhythm? Because our heart also pumps like this, 1, 2, 3, 4. With the same rhythm, you have to do the compressions, 1, 2, 3, 4. So exactly what are we doing? Person who's collapsed, if the blood doesn't reach the brain in 3 minutes, he's going to go brain dead, and 10 minutes he's gone. We do not want this to happen. So this heel of the palm becomes his heart. The moment you keep the hand in the center of the chest, you compress down and you recoil, that is, you allow the chest to rise. Blood from his heart is pushed to his brain, keeping his brain alive. See how important this is. But doing this is not easy. You're on your knees, you're giving the full pressure from your shoulders. After some compressions, you will tire out. And if you tire out, you will not do effective compressions. But doing it is important. So what do? So one thing is good in our country. If somebody collapses, you have 10, 15 people stand around him, giving free advice. Throw water on his face, put a slipper to his nose. We have to say, no, we know what to do. And you start the compressions, tell everybody around you, watch how I'm doing. The moment you feel slightly tired, you tell the person in front of you, now you take a turn and do this. Then you take a turn and do this. Let people do this turn by turn so that effective compressions are being done. While the other person is doing it, you can check whether he is doing it correctly and call the ambulance as well. But till how long do we have to do this turn by turn? So you continue doing chest compressions turn by turn till 1, he revives. That is, he opens his eyes, he starts breathing, you stop your compressions. Secondly, if your cardiac ambulance arrives, then you will pass him on to the doctor to take care. Or thirdly, if somebody brings this machine to attach the pads, you will stop compression, or you're going to continue doing compressions. Doctors have done this compression even for an hour and a half and saved somebody. So remember, in a cardiac arrest situation, the person is almost gone. You cannot do anything worse. You can only bring him back to life by doing what you're learning today. So chest compressions in the center of the chest at the rate of 100 to 120 beats per minute, going down 5 centimeters and recoiling, doing this turn by turn till he revives or till your cardiac ambulance comes. Yes, Anand.
Let me tell you two or three odd things about CPR. So the full form of CPR is cardiopulmonary resuscitation. Cardio means cardiovascular. It's about the heart. Pulmonary means lungs or something to do with the lungs. And resuscitation means revival. So you're trying to revive a person via performing CPR. That's why it's called, CPR via the compressions. The other thing that I can tell you about CPR is, whenever we've seen CPR being done, either on television or in the movies, we've always noticed that while they provide CPR or after immediately they've done CPR, they always provide mouth-to-mouth resuscitation, like trying to give air from the mouth. Now, I'd like you to know that you don't have to do it. There is no requirement for anybody to perform mouth-to-mouth if the situation is absolutely normal. And when I say normal, I mean you have just seen the person collapse, and it's not just been even a minute, and it's absolutely, the circumstances are normal, as in there is no water body involved. There's nothing else that you can see that you can identify as it being different from normal. Okay, so you don't have to do it, just do it the way you just saw being done, and that is known as hands only CPR. You do this and that is going to be quite enough to save the life of that person. Having said that, I want you to know that the mouth to mouth, it's not like it's never done. So it's done, but in different circumstances. So for example, if the person is drowned and somebody's got him out of the water after a longer period of time, or the person is asthmatic, or it has been a drug overdose case, those are the reasons when you perform mouth to mouth. Otherwise, you don't really have to do it. Okay, and the last thing that I want to say about is the CPR is never done on a person who is breathing. So remember that. And what I mean by that is, if a person collapses, it should not be understood that it's cardiac arrest and you have to perform CPR on that person. That is not necessary. You have to check whether the person has actually gone into a cardiac arrest situation. So if the person is not responsive and the person is not breathing, if these two conditions are met, then it's understood that the person has now gone into a cardiac arrest situation and CPR needs to be started absolutely immediately. At the same time, remember not to perform CPR on any person who may have collapsed and may have become unconscious, but would be breathing. And that includes the victim of a heart attack. Okay. All right. So, ma'am.
So we're going to go to our fourth step now, where we're going to learn how to use the AED machine. So this is an AED machine. The full form is automated external defibrillator. It's also called a shock machine. In case you've seen this machine in any other shape or color, please do not worry. There are different manufacturers, but they all work the same way. So this is how the machine looks from inside. There's a pull lever here. The moment I pull open the lever, it's going to tell me what to do step by step. So I'm going to do that. I'm switching it off to explain to you, but in case you ever use this machine, you will keep it on at all times. So the moment I've opened the machine, if you can see, there's a set of sticky pads. They are electrodes. Each pad has got a picture with an arrow indication where this needs to be attached on the body. So this one says on the right-hand side below the collarbone, and this one says here on the left-hand side below the ribs. So just like how it's given in the picture, I'm going to peel it off and attach it and show it to you. Remember, the pads need to be attached the way the picture is given because our heart is here. And when the shock is delivered, it needs to go through the heart. That is the reason why the picture is given. Just follow the picture and attach the pads. The second thing is these pads need to be attached on dry and bare skin. So if the person is perspiring a lot, taken out from a water body, or it's raining, make sure you wipe the portion and attach the pads so that they stick properly. Secondly, bare skin is important because these are electrodes. If you put them on clothing, they're not going to give a shock. Now, there's a small problem in this. If it's a public place and a man has fallen, you just lift up the shirt, open the buttons, attach the pads. But the same thing can happen to a lady. At that point of time, modesty comes in the way. Especially the public will say, why are you removing the clothes of a lady? So we have a small solution. The lady is wearing a sari. You just adjust the sari blouse and attach the pads. But if it's a full suit, then inside the box here, there is a pair of scissors. All that you need to do is remove the pair of scissors, cut open this portion of the clothing and that portion of the clothing and attach the pads. You do not need to remove the entire clothing. So modesty will also be saved and the life will also be saved. So we've attached the pads on dry and bare clothing. Now on bare skin. Now let's listen to what the machine says.
Place pad. No one should touch the patient. Analyzing.
It's analyzing the heart rhythm on who you've attached the pads to.
No one should touch the patient. Analyzing. Shock advised. Stay clear of patient. Press the flashing orange button now.
It's telling you to press the button.
Deliver shock now.
Press the button to deliver shock.
Press the flashing orange button now.
So I'm going to do that.
Shock delivered. Be sure the ambulance service has been called. It is safe to touch the patient. Start CPR.
So what did the machine do? The moment you attach the pads, the machine first of all analyze the heart of the person. Once the machine analyzes the heart, the machine will decide whether the shock is required or not. You are not going to decide that. If the machine feels shock is not required, the machine itself will say shock not required. But if the machine feels that the shock is required, there was a button that was flashing. All that you need to do is press that button to deliver the shock. But when you press the button, the person is going to get a shock. At that point of time, you do not have to touch the person. Otherwise, you will also get a shock. So just press the button. After the shock is delivered, the machine says, now you can touch the patient and start CPR. So you will not remove the pads. You will not switch off the machine. You will continue to do CPR in the center of the chest because the machine has asked you to do so. For 2 minutes, the machine is quiet. It allows you to do CPR. Then it goes into the second cycle. Second time, it will analyze the heart and decide whether the second shock is required. Because it's not necessary in one shock, his heart may start pumping. He may require 2, 3, 5, 10 shocks. But how many shocks to be given? The machine is only going to decide that. All that you need to do is listen to the prompts and follow what the machine is saying. Remember, this machine is made for your use. So if you have the machine in front of you, please use it and you can also save a life of a person. 2, 3 things about the machine. One, it works on battery and the battery life is for 5 years. So there's no problem in maintenance or usage of the machine. After 5 years, you can call the manufacturer, get the battery changed and continue to use the machine. Secondly, the pads. These pads need to be attached on the skin. In case you use these pads once, they need to be replaced after every use. So one set of pads is attached to the machine, another one in the box. In case you've used it, you can call the manufacturer and get the pads replaced and keep it ready for you. Thirdly, the approximate cost of this machine is about 1 lakh. Different manufacturers, different costs. But this machine is not a machine that is an everyday use machine. So you do not need to keep it in your house. If it's a big society, you could keep it in the lobby, college campuses, railway stations, police stations. If this machine is placed in all these places, India will be a safer place to be. So with this, we've completed our 4 steps. We've recognized a cardiac arrest. We've called for a cardiac ambulance. We've learned hands-only CPR, and we've learned to use the aiding machine. Thank you.
Thank you.